Total thyroidectomy is a surgical procedure
where the entire thyroid gland is removed,
primarily to treat thyroid malignancies, large goiters causing compressive symptoms, multinodular goiters with suspicious or symptomatic nodules, and hyperthyroidism when other treatments are ineffective. Ultrasound imaging after surgery may reveal the absence of normal thyroid tissue, with post-surgical changes appearing as hypoechoic or heterogeneous regions due to scar tissue development. Color Doppler imaging can detect changes in vascular flow, indicating the presence of residual or recurrent thyroid tissue or malignancy. The procedure is also used to treat recurrent thyroid cancer or for cosmetic reasons when goiters or nodules cause significant aesthetic concerns. Indications for total thyroidectomy also include large goiters causing compressive symptoms, multinodular goiters, and indeterminate nodules with a high suspicion of malignancy. Understanding the indications and post-operative imaging findings is essential in the comprehensive overview of total thyroidectomy. Are you considering a total thyroidectomy? It's important to understand what to expect after the surgery. Let's talk about the prognosis, complications, and difficulties you may face. And first, let's discuss the prognosis. If you're having the surgery for thyroid malignancies, such as papillary or follicular carcinoma, the outlook is generally favorable. Successful removal of cancerous tissue, combined with follow-up treatments like radioactive iodine therapy and thyroid hormone replacement, can lead to a positive outcome. Regular monitoring through imaging and thyroid hormone level tests
is crucial for detecting
any recurrence early. Now let's talk about potential complications.
The most common one is hypocalcemia,
which occurs when the parathyroid glands
are accidentally damaged or removed during surgery. This may require calcium and vitamin D supplementation to manage.
Another significant complication is injury to the recurrent laryngeal nerve,
which can cause hoarseness,
voice changes, or even vocal cord paralysis. Hypothyroidism is also inevitable, since the entire thyroid gland is removed and lifelong hormone replacement therapy will be needed. Post-operative bleeding, formation of a hematoma, and surgical site infections are rare,
but still possible complications.
Post-surgery, you may experience
some difficulties.
One challenge is adjusting to lifelong hormone replacement therapy.
Regular blood tests will be
necessary to monitor your hormone levels and adjust your treatment accordingly. Managing calcium levels can also be tricky if you develop hypocalcemia. If the recurrent laryngeal nerve is affected,
persistent voice changes may occur. Continuous vigilance is required
to monitor for any recurrence of thyroid cancer.
Lastly, the need for lifelong medication,
regular follow-up appointments,
and the potential for complications can take a toll
on your psychological well-being.
In conclusion, a total thyroidectomy
has its challenges, but with appropriate care,
monitoring, and patient education,
many of these complications
and difficulties can be addressed. Understanding the potential risks
and being proactive in managing your health can lead to a better overall quality of life. It's important to have open
and honest discussions with
your healthcare provider about your concerns and questions. Best of luck on your thyroidectomy journey.